Good afternoon. Welcome to the weekly Facebook Live. I'm Justin Westmiller, the Director for St. Clair County Emergency Management. And with us today, as always, is Dr. Annette Mercatante, the St. Clair County Medical Health Officer at the St. Clair County Health Department. And I think, like we always do this time every week, we'll jump right into the data and we'll move on to questions after that. So, totals to date. So unfortunately, we've crossed over that 10,000 mark. We have 10,818 total cases, 557 hospitalized, 256 deaths, 8,712 recovered. Changes in the last 7 days, we've had 1,006 new cases with 144 average new cases per day, 498 average tests per day with a 20.2% positive test, which is very high. So this is the really telling story. We've really shot up on our cases per day, and this is the graph that shows where we are in our peaks and valleys. And the first peak on the very left is where our first run of this disease was back in March and April. And the second one started in October and went until basically the end of January. And this third one started just about 23 days ago. And it's taken us 23 short days to get up to that 20.2% positivity and around 144 cases per day. So we need to be very cognizant of that. We are in a very dangerous position right now. And this is our tests. This is where we are testing right now. As you can see, our testing positivity is above that red line, and that is also a precarious position. Some good news, our vaccine data. So we have kind of began doing some really great numbers with vaccines. That top number there, 46,674 vaccine doses have been administered here in St. Clair County. And the total number of COVID-19 vaccine doses distributed is 56,490. So that's really, really good. The other good number there, 52.8% vaccine coverage for those 65 and over, which is great news for our 65 and older population. As always, you can find our up-to-date everyday information on our dashboard at stclaircounty.org/offices/health/covid19.aspx. All right, let's get to questions.
Before we get to the questions, Doc and Justin, can you just talk through your talking points at the top of your page first?
Absolutely. Uh-oh, it looks like we lost Doc's audio there for a minute. So I'll go ahead, Doc, if you want to check your microphone real quick, and I'll go with mine. So for us, we just spoke about it, but testing remains critical in slowing the spread of this virus. That is one way where we're going to know where the hotspots are potentially are in the county, as well as where we might start seeing these variants that you're hearing a lot about, such as the B117. There are many providers, both locally and regionally, and also the St. Clair County Health Department is conducting testing daily, Monday through Friday, from 8 o'clock until 3:30. That testing site is at 1168 Gratiot Boulevard in Marysville, and you can sign up for appointments at scchealth.co. You can also call for appointments at 810-987-5300. And another really good thing that's happening here in the county and statewide is that vaccine eligibility is opening up very wide. This week, we crossed over the threshold where 16 and older with medical issues, with severe medical issues, are eligible now for the Pfizer vaccine. And once we cross over the April 5th threshold, the vaccines will be available for everybody 16 and older, regardless of medical issues or anything else. So please pre-register for the vaccine everywhere you can, but you can also pre-register for it on the St. Clair County Health Department website, again, at scchealth.co.
Can you
All
hear
right,
me
Doc.
now?
Yes, ma'am.
Can you hear me now? Oh, yay.
Yes.
Okay. When in doubt, rebout, right? Okay. My talking points. To schedule your appointment, remember to answer your phone when we or a Kroger pharmacy calls you for an appointment. In fact, that would be for anywhere that you've signed up for vaccine, Myers or McLaren. The number from us will be at 810-987-5300 number. And the number for Kroger's is 586-697-8341 or 8340. So that Kroger's will be a 586 area code. Also, don't forget that we do send out appointments a variety of ways, whatever information you left us, which could include your email. And do check your spam folders for emails. They could be going to your spam folder, so check those every day. So vaccine clinic reminders, remember, we do have wheelchairs for your use, but we want to encourage people to bring their own walkers if you know that would assist you. Please arrive no sooner than 15 minutes before your appointment. If you're parking, just stay in your car. We have vaccine for you. We're not going to run out of vaccine, and we want to avoid those long lines. If you are in line, 6 feet, people. Stay 6 feet away. We've got staff going up and down, but we don't want these vaccine clinics to be the source of an exposure. So with that many people, we just really need you to wear your masks all the time and keep your distance from other people. And it'll help a lot if we don't form those long lines, if you just wait in your car to your appointment time. So that's just some gentle reminders, and we'll keep trying to tweak that system so it works better and better every time we do it.
Yeah, and to add to that too, we're actively looking for more vaccinators. So it is our goal by the next vaccine clinic to have quite a bit more vaccinators in the room. So we're working on that diligently here in the next few days.
All right, let's jump into the questions. Justin, your first question was from last night on the Facebook feed. With these larger mass vaccination clinics, are you concerned about people coming in who have COVID and exposing others?
So yes, that's always a concern, but we are working very diligently on the mitigation measures to ensure that we keep that from happening. So we're doing things like having staff and volunteers rapid tested prior to them entering the building to conduct their work for the day. We're providing hand sanitizer at each station and promoting that usage all day, every day. We are regularly wiping down surfaces. We actually have volunteers that are walking around with cleaning products to do that. We're ensuring 6 feet of distance between clients as much as possible all day long. And we are doing a symptom exposure check at the door, both temperature check, and they're doing a questionnaire. And then we're also very strictly enforcing masking protocols, not only while people walk in the door, but during the entire clinic.
All right. Doc, your first question, is it okay for me to take antibiotics my doctor prescribed me before my second dose of the vaccine?
Yeah, probably. Antibiotics do not impact the immune system in any way, and we don't want you to not take a prescription that your doctor has prescribed to you. The vaccine should not interfere with your antibiotics, and the antibiotics should not interfere with the vaccine. So I think you'd be fine.
All right, Justin, your second question. I have mobility issues. Can I have someone drop me off at the front entrance at the vaccine clinic?
So we do not ask you to drop people off at the front of the vaccine clinic, but we do provide a service with golf carts where you go ahead and park anywhere, and one of our golf carts will come to your vehicle and pick you up. And if you have any sort of walking device or actually a wheelchair, we'll strap that wheelchair or walking device to the back of the golf cart and transport you right to the door and help you get inside should you need that assistance.
Yeah, and I'll just say I want to encourage people with special needs to go ahead and let that front staff know about that. We should be able to accommodate special needs in any way needed.
And we have plenty
Great.
of staff to help with that.
All right, Doc, your second question. What if you get the first shot and you have a bad reaction to it and don't do the second shot? Can you explain if you would have enough of the vaccine to protect you?
So I'm assuming you mean, can you explain if one vaccine provides enough immunity to protect you against the virus if you were exposed? We really don't have an answer for that. We know that a single vaccine in a 2-dose series provides some protection. The reason they went on and said to do a 2-dose series is because that amount of protection doesn't reach that 50% threshold that the FDA required for approval. So for the emergency use authorization. So I would say you get some, but I would continue to use other strategies to reduce your exposure. And we'll know more as time goes by. We also don't know if you've had a reaction to the mRNA, if other vaccines will be acceptable. And hopefully we'll have more information for that going forward. But I agree, if you have a bad reaction to the first one, we're going to discourage you from getting that second dose.
All right, just a couple more questions for you, Doc, from yesterday. If you come down with COVID symptoms after the first dose of Moderna, will it be less severe?
Maybe. We don't have the data for that either. I'm sure we're looking and collecting that information. It would make sense that you might be less severe, but I don't have the data to really share with you on that.
All right, next question. Someone said, my husband said he heard quarantine time is now only 1 week. Is that true?
In a word, no, but it's more complicated than that. So the CDC does have on its guidelines an option to reduce quarantine to 7 days with a testing strategy at 3 to 5 days. Okay, now that is based on a number of assumptions. You're not worried about the variant. You're a low risk individual. There's a variety of situations where that would be an option. The Michigan Department of Health and Human Services has not adopted that option for a number of reasons, but the most important one is that graph that Justin showed you. The fact that we are accelerating in cases, we have a grave concern about the variant being very prominent in our community, and that is not the time you want to reduce quarantine standards. So we compromised. MDHHS did allow for 10 days of a reduction in quarantine, but the appropriate quarantine period is still 14 days. That is still the ideal duration to be sure that you no longer have the ability to be incubating and transmitting that virus unknowingly. So as we go through these next few weeks and try to control this virus from going any higher, we need to try and stay closer to the 14-day guidelines, in my opinion, than 10 days. We still allow 10 days in many circumstances, but a shorter than 10 days at this time is really not in my mind, in the mind of our state experts, the best option right now. So more to come on that. And by the way, the 3 feet rule that the CDC has also released as far as distancing between students in a classroom. It's very specific for students in a classroom who are wearing masks, who have all the other strategies in place for reducing risk. Only applies to how far apart students can safely sit. It has not changed the quarantine rule for 6 feet. So when we are evaluating who has been exposed to a positive case in a classroom, it is still 6 feet with 15 minutes exposure. That has not changed for our community. And I know there's some variations in a couple places in the state. There's some variations in Ohio, but we have not gone there yet, and this county has not gone there yet. We'll revisit that. We'll revisit that when our cases are under control, and I can tell you that we have positivity testing of 5% again, and that we don't see any acceleration of cases.
All right.
And if I can add real quick, Elise, we are looking forward to doing things like that.
Yes, we are.
Extremely forward. So.
Yeah.
Okay. All right. Another question about quarantine. I'm fully vaccinated now, but if I am around someone with COVID, do I need to quarantine? If yes, how long?
So if you're fully vaccinated, meaning you are 14 days, at least 14 days out from your last vaccine. So for the 2 mRNA vaccines, the Pfizer and Moderna, that would mean 14 days from your second dose. And if you received the J&J vaccine, a Johnson vaccine, it would be 14 days from your one and only dose, because that's a single dose vaccine. That's considered fully vaccinated. And at that point, if you were exposed, you would not need to quarantine, obviously assuming you're not sick, right? If you're sick, we want you to still get tested because vaccines are not 100% effective. But if you're feeling well and fully vaccinated, you do not need to quarantine.
All right. The next question is, where are all the new cases coming from? Is it schools, clusters?
Who wants to get that one? That's a tough question because, you know, we can only look at trends and look at our data compared to data that we had before, compared to other communities. But there was one clear difference in our data in the last couple of weeks, 3 weeks, and that is the age distribution of cases. There was quite a bit more of a peak of cases in the 10 to 18-year-old than what we saw back in October before our second big peak. Now, did that drive the entire thing? We can't say, but there seems to be a correlation between the transmission of this virus in that age group and the overall community transmission that we're seeing. Maybe it went the other way around. You know, maybe we had more community transmission, and that's why that age group got nailed, because they were out there. We had opened up schools and we had opened up sports, and they were just kind of available to get infected. But that is the only difference we can really see. Variants, possibly. Again, we don't have any definitive proof. I believe we only have 6 confirmed variants in our community, but none of them had traveled. So you're assuming those that got infected here got infected by this variant here. So that may be playing a role in this as well. And as you know, this virus is respiratory transmitted. So it's behavior. It's people-to-people transmission that is always the driver of these transmissions. And so we have to look at our personal and collective behavior.
All right. And here's the last one on the sheet. I refused the Pfizer shot. It's not FDA approved, and my grandma got COVID after getting her first shot within a week. Why aren't you telling people about this? McLaren had a tally of how many people have gotten what shot and got COVID from that shot. So far, it's the Pfizer.
Okay, let's pick that comment apart. So first of all, you cannot get COVID from the vaccine. There is no COVID germ in this vaccine. Okay, so the vaccine might make you feel achy, it may make you feel sick for a few days, but that's your immune system that is not getting COVID. So you will not test positive because you get this vaccine. If you get sick after the vaccine and you test positive, it's because the vaccine didn't protect you. And at a week, I might suggest that vaccine wasn't even effective by then. That positive test was a result of you being exposed either during or before you even got vaccinated. Remember, the incubation period for COVID is 14 days. 2 to 14 days is when you can get it actually symptomatic or get the infection. So that infection you could have been exposed, this individual could have been exposed to the infection a full week before they actually got the vaccine, and they just still weren't symptomatic at the time. So that is the thing to remember. So you don't get COVID infection from the virus or the vaccine, nor will the vaccine affect testing in any way for COVID, okay? So the second question is, people do get infected after the first dose. We are tracking all of the individuals who get infected after vaccine, but there is significantly less people getting infected after being fully vaccinated. And there's some unpublished data. We heard Dr. Fauci talk about that a couple days ago on some large trials at hospitals between staff that were fully vaccinated and those that were not. And there was dramatic differences in those populations. In other words, if you're fully vaccinated, you have a much lower risk of getting sick from COVID than those who are either partially vaccinated or not vaccinated at all. So the real world data is supporting what the clinical trials were telling us when these were first authorized. And then going back to not FDA approved, none of these vaccines, nor none of the treatments, nor any of the testing is FDA approved, because FDA approval requires a very prolonged timeline that we can't justify in the middle of a deadly pandemic. So there are rules and laws that allow for more rapid development of tests and treatments in a situation like this, in an emergency. And these are called emergency use authorizations. And this is what all of our vaccines, tests, and treatments for COVID are all being released under this emergency use authorization. They'll get to FDA approval eventually, but right now the focus is getting them into the communities that need them and saving lives with them, quite honestly.
Thank you, Doc.
Did I cover everything on that? I think I did. So, and by the way, there's nothing worse about Pfizer than Moderna. They are coming out equally strong. The J&J vaccine is a very strong vaccine. We're going to go back to saying, please don't pick and choose the vaccine and wait for the one you think you want. Number one, there's no side-by-side trials that compare the two. The data on all of these vaccines is excellent, both safety-wise and efficacy. And the most important thing, going back to that graph, we want this community protected as quickly as possible. You know, what is one of my biggest hopes right now, and that is this amount of vaccine that we've already got, which is, what do we say, 20% of the total population and about 53% of the 65 and older, that vaccination process is going to prevent people from getting hospitalized and dying, which is what we know this vaccine does. So the more people we can get vaccinated in the next several weeks, I'm hoping even if this peak goes up and stays up, that will prevent people from getting hospitalized and dying. So it really is a race to get vaccinated, and we want as many people to do that as quickly as possible.
All right, thank you, Doc. And yesterday on our Facebook live reminder post, we did have a comment. It said, thank you, Dr. Mercatante and the staff at the Knights Club yesterday. They did a great job. The line was long, but it moved very quickly. Everyone was friendly, and they really loved Dozer, the therapy dog. So thank you for that comment. We appreciate hearing those. So first question on the live feed. I asked a question about shut-ins last week. Where can I register?
Register on our website with everybody else. And then, I don't know, Elise, is there a place where you could add that you are homebound on the registration site? No, there is not. Is there a comment section? Okay, better to email us, covid19@stclaircounty.org. We are actively trying to figure this out, trying to figure out where you are and how many of those are out there so that we can develop a plan to get people to your home to vaccinate you. So please send us that information, and we will include you in whatever plan that we have to get you vaccinated. So covid19@stclaircounty.org.
All right. Next question. FYI, I saw on New York Times stats website that St. Clair County and St. Louis counties are in the top 11 hotspots in the country right now. Do we know why? Are the hospitals getting full again?
So I'll answer that. I answered that a little earlier. Do we know why? Absolutely no. We strongly suspect behavior is behind it. We have a lot of our population who doesn't believe that their personal sacrifice is valid or worth it. It doesn't take a lot to drive this virus. And then the concern is, of course, the variant. Are we a hotspot for the variant? We do not have the data to say for sure we do, but I would agree that the actual pace, the acceleration of these cases was stunning to me, and certainly not what we were watching this closely, and the way this took off was quite honestly like a shock. So more to come. I'm not sure exactly why, but like the wrong place at the wrong time with the wrong people. Maybe we're just really kind of got unlucky with that.
All right.
Elise,
Next question. Go ahead.
Can I jump in real quick? So for the very last question on the list right now, Mandy, take your father to an ER right now. If he feels like he's not being able to breathe and you are that worried about him making it, take him to an ER right now. Sorry. I just wanted to jump in there.
Yeah, I would agree. Their emergency room is obligated to see you when you show up. I'm not sure who told you not to come, but if it were my dad, I'd take him in to get checked out.
Sorry, I didn't mean to interrupt, but
good,
no, thank
good
you,
catch.
Justin.
I'm not reading all those, so thank you for looking at those.
Yep, thank you, Justin. All right, next question. Are we seeing any positive COVID test results from fully vaccinated people in our area?
I just asked that question. I'm sure we will. I don't have the number for you. I believe we have seen a couple of cases in people who've been fully vaccinated. I can't tell you how many. It's a handful. It's not a lot of people. And I know statewide and nationally, there is a robust surveillance system now working on collecting this information and just trying to see how this is going to play out. But, you know, again, I'll say no vaccine, no treatment, no infection plays out at 100% of anything. So you can't say, oh, I got, you know, this way. Even the way your body responds to the infection is extremely variable. But treatments, vaccines, none of them are ever 100%. So you just have to keep that in mind. It's not like it's the ticket out of jail card, right? You still have to be careful, especially if you're vulnerable, especially if you know you're around people who have COVID.
All right. The next question, this person was scheduled to get vaccinated on Wednesday. However, she developed an ear infection and sinus infection. How long does she have to wait before she can go ahead with the vaccine? She says, I understand I need to get better, but I'm on an antibiotic and steroid.
You know, I would probably just wait. A short-term steroid is not likely, like what we would use for a sinus infection, is not likely to impact your immune system response to a vaccine. And as I mentioned earlier, an antibiotic would not do that either. But the vaccine can make you feel kind of punky for a couple of days. I would wait till you feel mostly better, quite honestly. You know, I would make sure that your fevers are gone and that you're just, you know, you're not really struggling with your daily activities, and just make sure you're on the mend before you come in and get the vaccine. But you could come in and get that vaccine while you were still taking those treatments if they were more prolonged. I would just think clinically you should be feeling better.
All right.
Oh, and I should mention, it's always worth asking your doctor as well. So, you know, all those nuances of patient, physician, those are really important. Your doctor probably has much better insight into your health than I do. So if you're sick and you want to get a vaccine, talk to them about it. Talk to him or her about it, and they can help guide you as well.
All right, thank you, Doc. Next question, can you post a list of all the places someone can sign up for the vaccine?
Don't we have that now?
It is
On our website, scchealth.co. And every time we learn of a new place that you can get a vaccine, we try and add it.
It's
And
the state site and then vaccinefinder.org. They're
Okay.
having created by us.
it's the site that is created by the state, vaccinefinder.org. And every time a new entity gets online, they add it. It's maybe a week behind. It might be even a little bit longer than a week behind, because every week there are new places where you can get vaccine. But that would be the most up-to-date place to check. The other thing to do, of course, is just call. If you hear that somebody's giving a vaccine, you can always give them a quick call. For instance, some of our smaller pharmacies are giving vaccine now, right? Not just the Rite Aid and Myers, the Spartan vaccine, the hometown pharmacy in what town? Wadhams. And then isn't there another one in Yale? Anyways, so there's a lot of them coming on that, and some doctors' offices are getting vaccine.
That's what I was about to say.
FQHCs. We have a couple private primary care offices are going to start getting more vaccine. So ask your doc as well whether they're planning on receiving vaccine, because pretty soon we're going to start seeing vaccine in a lot of nooks and crannies. We've been told that vaccine allocation is going to be about the same for the next few weeks, but beyond that they're really gearing up for as much vaccine coming in as we can handle. So that's good news.
All right. Just a clarification somebody had. They said, I thought at last week's update you said 60 and over without medical problems were eligible. Can you clarify?
50 and older without medical problems. 50 and older. And 16 and older with a medical problem. And nobody has to show us any kind of medical documentation that you have it.
All right. Thank you, Doc. Next question. We are going to keep seeing numbers spike because there are still people doing whatever, whenever, and it's never going to go away. People are getting sick even with the vaccine. So how long does this vaccine last to help lessen symptoms, because it doesn't stop you from getting it?
I'll take that one and give you a rest for a minute if you want. So yes, we're seeing very minimal numbers of people that are getting sick with the vaccine, but they're really getting also minimal symptoms, right? Yes, they're coming up positive, they're not feeling well, but they're not going to the hospital, they're not passing away, they're not coming up with major symptoms that cause them to have, as many opportunities for lifelong symptoms and lifelong medical issues. So the vaccine still has a lot of good to do, even if a very small number of people are coming up positive. The one bad thing that's happening when they do come up positive is they have the opportunity to spread the disease, which why it's still a problem, but it's not as much of a problem as it could be if everybody just went unvaccinated, as you know. So, and like Doc said earlier, we are struggling with some behaviors, and that is something we're working diligently on.
How do you change somebody's behavior? I do want to say that the vaccine is likely going to be helpful in stopping some transmission of virus. We just don't know how much. Most vaccines do, because they prevent the virus from replicating enough to make you sick. So it would make sense. We do know that viral load, how much virus is actually in your body replicating and coming out, is a big factor in how quickly you can transmit it and how sick you get. So which is why masks are so great. So even though a mask doesn't prevent all the virus from moving around, it prevents a lot of it from going from here to there. So viral load is important. So vaccine is going to be helpful in slowing spread. And as Justin said, it's certainly going to be very helpful in reducing that worst case impact, right, of hospitalizations and deaths. And I said this before, if this was just a virus that caused some sniffles and some inconvenience, nobody would be taking this level of engagement to try and slow it down. This virus makes a significant portion of people really ill, probably 15 to 20% really sick. Many of those have this long COVID stuff, right, where you feel sick for a really long time. And out of those, I believe right now our data is 2% mortality rate. A 2% mortality rate in a community our size is thousands of people. So this is why it's so important to get vaccinated. So I would say our goal is we have to maximize and compel people to want to get vaccinated, because we have to reach that herd immunity to slow this down. Even if there's people who don't want to pay any attention, if the majority of us are doing it, it's still going to help. So I would say don't worry about other people's behavior. Just worry about your own. Just, do the right thing yourself, and I think we'll make some progress.
All right, Doc. Just more kudos to our staff who worked yesterday's clinic. Thank you all. It was a quick and easy process, it seems, for many people. All right, the next question. When the vaccines are available to 16 and older, can you confirm that a 16 or 17-year-old will require parental permission to obtain that vaccine?
Yeah, you'll need consent. They will, because they're minors. So that minor will need consent. And remember, a 16 and 17-year-old will only be able to get Pfizer. But if you show up, most of these large community clinics, we have both products, we have both formulations, so that shouldn't be an issue. And just going back to our clinic really quickly, and thank you for the thank yous. But there was nobody, even when that line, and there was a point where that line wrapped around the building and it made my heart sink, but none of those people waited longer than 45 minutes to get vaccinated. So the key with that, number one, is to keep the line shorter. But again, for when they're in line, that you guys stay far apart. It might make that line look longer, but please don't let that line discourage you, because people moved through very quickly despite the fact that it looked horrendous. We have a lot of vaccinators, and that process goes very quickly, actually. So.
All right. So next question. Per governor orders, any school sports participants will be tested daily before each practice and games. Is that correct?
No.
Daily?
So
no,
it's not daily. So if I can explain too, it's actually not an epidemic order. It's an MHSAA rule. So, and it's only high school and middle school sports, and it begins after April 1st, and they are required, spring sports will be required to test once per week. It will also impact a potential couple, and it'll be a very few winter sports players. And that program starts April 1st. That's when it will be state supported. But it is an MHSAA rule, and it will only be required once per week.
Can I add to that, though? Because,
Absolutely.
the sports like wrestling and cheer that you can't wear a mask safely, they were required to do 3 times weekly. So maybe that's where that came in. And here's the other thing, though. The whole point of testing is not to punish students so they can't play. The whole point of testing is so we can identify people who have the virus before they have the opportunity to spread it to more people. In my opinion, and this is not part of the rule, but every extracurricular activity that brings groups of people together should test. And once a week testing is not that onerous. We can ramp up our testing capacity in this community. We have lots of opportunity to grow that. But if you are in a bridge club that gets together once a week and sits inside, and you have people that aren't vaccinated or can't vaccinate, testing once a week is just a smart idea. Though this isn't punishment. This is a way of trying to manage. So bans, whatever. It's not just about sports. I love sports too. It's not just about our athletes. This is about when you get a group of people together that are hanging close together for periods of time up to a couple hours. It's just a breeding ground for transmission, and that's all this testing is a tool to try and reduce that and identify it early. So I just want to say that because I know it's like the rule says this group and only here and only on this date. That's all the bureaucracy we need to like put rules in place to compel people to do things. But the right thing to do, if you're in a group outside of your household pod where you're not going to be wearing masks and you're going to be near each other, the right thing to do is test. It just is. So I'm just leave it at that.
And one last thing to add too, remember, these are just the nasal swab that really only has to go to right here. It doesn't have to go way up in your sinus cavity. And it's very quick. It takes less than like 25 seconds to do the whole thing. And the students, the students do the swab, which they do basically to their own comfortability. Yeah. So it's really,
and
really
I heard a presentation today where we can do it with saliva. So testing capacity, testing technology is just going to get better and better. Right. So if we need things like that in our community, we identify that and we do it. So yeah, don't be afraid of it. Please don't be afraid of it, people. It's really for your benefit and not in any way intended to kind of scrutinize or punish people.
Yeah.
All right. Next question. Why are vaccination rates so low in our county compared to rest of state?
Oh, that's a $64 million question. We actually have work groups that have formed on this topic. We actually have a couple now that are very actively looking at this. We are not a good vaccinating community. We have not been. When you look at, for instance, flu vaccine, I'll give you an example. We were just comparing our COVID vaccination rate to Grand Traverse, which is doing really great. They have vaccinated 80% of their 65 and older. I'm telling you. So yeah. So I'm happy we did 52. It's not good enough. It's not good enough. So I got on the phone. We had a little meeting with this health department. I gotta be honest with you. I don't think as a health department we're doing really anything different. They're not really getting that much more vaccine than us. There's a little variation there, but they have a community that it ranks number 1 every year just for flu vaccine. Okay, number 1 or 2, depending as them in Washtenaw County. You know where we rank every year for flu vaccine? Almost dead last every year. We don't like to vaccinate in this community. And that, my friends, is a cultural issue, not a issue of access or intelligence or anything like that. Our demographics for college education and everything else are good. We don't encourage people. You're not encouraging your neighbors and your families to vaccinate, and that has to change. That's the real issue that has to change. And I would love to have more input on how we can do that. So I got a lot of smart people working on it. And I wish I knew. I wish I knew. You can hear my frustration because this is an area that I think really does need a lot of attention in our community. It's gonna nail us with COVID. If we can't get our vaccination rates up to where they should be, we will be a disproportionately impacted community with COVID. That means our workforce will be impacted. It'll mean our economy is going to be impacted. Our tourism industry is going to be impacted if we have a lot of COVID cases because we don't vaccinate. So this is really important, Anna. Thank you. Thank you for bringing that topic up because I think it needs a lot of attention.
All right. And Doc,
Sorry.
I'm seeing some...
I went off on you a little bit there.
I'm seeing a lot of questions about people maybe having some issues with registering on our website or maybe other websites. But if folks do have questions about registering on our website, please email us at covid19@stclaircounty.org. I think Doc and Justin had talked about that earlier, but please send an email there and we can help you out. All right. Next question. My sister and my niece are both COVID positive. My niece, no symptoms. My sister, sinus issues. Are they only required a 10-day quarantine?
Yeah, the vast majority of individuals no longer shed virus after 10 days. regardless whether they're symptomatic or asymptomatic. So 10 days is adequate regardless of your symptoms. Now, if you are very severely impacted, hospitalized, immune compromised, that's something we could extend the isolation period for. But in general, even if you're still a little symptomatic after 10 days, you're no longer shedding the virus and we feel comfortable that you're not going to make other people sick.
All right. Next question. I'm not sure what she's trying to say, but it says, why does our county report of cases different from states?
We've talked about that a lot. So
Okay.
I'll take that one. So Doc and so as you know, we are kind of on the ground handling this, at the local level. So we are kind of taking numbers in, and every once in a while, a couple of numbers will go out because the cases that get reported to us may be Macomb County cases or Lapeer County cases or Sanilac County cases, or they might even be from another state. So those numbers are always changing just a little bit or moving around, or we're getting incoming cases from another county. This data is new and raw, and it really won't be settled in for months probably, so that it's enough to be really solid and sure. So depending on any of that data day to day, you really have to take, like Doc always says and Brandon always says, follow the trends. Don't follow the day-to-day numbers per se. Watch what those graphs are doing. That's really where you find out where you see the meat and potatoes of it all.
Yeah, and another aspect of data collection when you're talking about disease surveillance is that there are different ways of diagnosing a disease. And so there are standard definitions for disease surveillance. I believe that they're national standards for confirmed, probable, and suspect cases. But there are variations probably from state to state about how many are counted and shifted from one to the other. And so that, in fact, the definitions for confirmed, probable, and suspect cases has changed, even in our own state. And some states only count confirmed, and other states count confirmed and probables. I don't know if anybody, so those are the variations that can change. But as Brandon or Justin has said, that really the proof is in the trends. And you may not be able to say, well, we've got 1,428 cases versus 1,652 cases. That amount of variation could very easily be error in collection, or somebody being called probable when they're really a suspect or something like that. But what's important is last week we didn't have 1,000 cases. And so that's where the proof in the pudding comes through. And so you're right, surveillance on disease surveillance is complicated and it can vary, but there are also epidemiological tools to standardize this over time. So we will get better at standardizing disease clarification or classifications, and that reporting is going to become more standardized over time. Remember, this is our first year, and we've had a few rough starts for that. So,
all right, we still have several questions left on the feed, so I know we're approaching an hour here, but let's get through as many as we can. When does the 14-day quarantine start? After all symptoms are gone, or 14 days from first symptom?
Okay, so isolation is when you separate yourself from other people when you're sick or you're a case. Okay, you test positive or you're sick and you're positive. That's isolation. That's 10 days from the day you become sick, or if you're not sick, it's 10 days from the day you were tested. Okay, that's isolation. Quarantine is when you've been exposed to somebody else who's sick, but you yourself are not sick or testing positive yet. So you're quarantining, you're separating yourself from other people in case that virus is replicating inside of you and start shedding before you become aware that you're sick or you're positive. And we know that this virus is notorious for being the peak of its shedding is before you get sick or the very onset of your illness. So before people really even have a chance to test, which is why we tell people 14 days from the last day of your exposure. So when does your quarantine start? It starts from your last exposure. And let me give you an example. And this is a common cause of confusion. If you're living in a household where mom has COVID, and you're all living together in this household, and you haven't mom's not living in the basement, you're all living together as households need to do sometimes. Mom is now in isolation for 10 days, from the first day she knows she's sick till the 10th day. Her last day of being infectious is day 10. That means your first day of quarantine, if you live in that house, is on day 10 of her isolation, not on day 1 when she found out she was infected, because she can be infected that entire 10-day period. And so your last day of exposure is going to be on your first day of quarantine is going to be on her last day of isolation. Now that's if you're all together. There are families that when somebody comes positive, they move out to the barn, or they figure out a way of separating themselves. But your quarantine begins day 1 on your last day of exposure. And that is at my 14 days or 10 days as an option. If you're not ill, you're low risk, and you can continue to monitor yourself for the remaining 4 days.
All right.
Okay.
Thank you, Doc.
That's
All
that's a really common question, and it's a big story. By the way, we just did a quarantine summary that I went through all of this, and it's now posted on our website, and we'll update that if and when quarantine standards change. So I know there's a lot of confusion about that. So we do have a one-pager on our website now that you can go and look that up. And we probably should have had it there forever. I'm sorry we didn't get it up sooner. Our bad.
All right, Justin, can you answer this one? Is the Johnson & Johnson vaccine available in our area?
So we do have all 3 vaccines in the county now. So yes, that's available. However, I do want to remind everybody that unless there's some sort of circumstance, and that's really highly irregular, we do urge everybody to take the first vaccine that's available to you. Really, the only reason that we would prioritize a vaccine is for the 16 to 18-year-old youth, because that's the only one that's been approved for the 16 to 18-year-olds. Other than that,
you mean with Pfizer? Yeah.
Right.
And by the way,
yeah,
we're not sitting on a lot of J&J. We
right.
got one shipment where we still have a few hundred doses, and as Justin said, we're trying to prioritize that for people who would have a great deal of difficulty getting their second dose. So we will get more though, and those J&J vaccines will be prioritized for populations that would have a difficult time coming back and getting a second dose. You're homebound, some of these homeless people who you really have a hard time getting back to for the second round. So there will be some prioritization for that vaccine when we get our hands on it.
All right. Thank you, Doc. Next question. My mother-in-law called me wanting me to take her to get COVID tested per her doctor. She lives in senior housing, no transportation. Me taking her risks infecting my whole family. Is there any mobile testing available to seniors?
Not right now that I know of, but it's a great question and something maybe we need to think about as our capacity expands. So thank you for that question. Now, I can tell you that if you schedule for testing over at our Marysville site, our nurses will come out and test right at in your car, so you don't have to get out of your car. So at least we could do some drive-through for somebody like that. But thanks for the suggestion of mobile testing. I like that idea.
All
Do
right.
me a favor, Miss Stephanie, send an email to COVID-19 with some details, and if we come up with anything, either way we'll get back to you. But if we can come up with anything, we'll get back to you as well.
All right. Thank you, Justin. Next question. I'm registered with Health Department I'm assuming for the vaccine, but no call yet. Any idea when I can get the shot? I have a heart condition and am 61 in April.
Okay, so 50 and older, you're registered. How many of the 50 and olders have we gone through? I don't have that.
Just started.
Everbridge? Yeah, we just started that on Monday. So obviously we had a
I have the
that
numbers
Everbridge
on
list,
that.
so-
Would you want me to jump in?
I-
So
Well, I just know
Go ahead.
that for certain populations, so for 65 and older, we've gone through about, there's only about 5 to 8% people left 65 and older that haven't been notified at least once. For the 50 and older, it's probably a little higher. I'll give you an idea. Did you have that? How many
I
we've
do.
gone through?
It'll take us about 2.5 weeks to get through that whole group.
Okay.
All right, next question. I've heard
Good enough.
rumors circulating that due to high increases of cases in our county and a high positivity rate, that the health department could be closing all schools, including elementary, for our entire county on or around spring break. Is this something we as parents should be preparing for?
So far, our county schools, all of them, parochial, charter, and our public schools, have been working very closely with us every single week, reviewing issues, cases, and the pausing of schools is occurring when those schools are anticipating and noticing problems with their cases and their transmission. Okay, so we haven't had to order any closures, but they are pausing based on our recommendations. So the recommendations would come if there was, in fact, evidence to suggest there was student-to-student transmission in the classroom setting, which is a little tricky to figure out. And now having this experience in the last week, we might be a little quicker to worry about it. But it's not like there will be in my opinion, a blanket pause of all schools. It will still be, just like there's no blanket pause of all extracurricular programs or sports programs, because it's really based on that group itself and their risk. If you guys are doing well, we want you in school. I mean, we want our kids and our students to be doing all the things they're doing. So if it's going well, we'll hold off. If it's not going well, there's going to be a discussion, and the parents are going to be a part of that discussion, hopefully early on. And these decisions are made in conjunction with our advice, but also your boards of education are brought into this because they have administrative authority as well. So I think personally it was a fortuitous pause just before spring break. I think it came at a good time where people can regroup, they can quarantine, they can retest before they return. And by the way, there are going to be pop-up testing facilities throughout the county. I believe we're going to have at least 3, one in Port Huron, one in Yale, and I believe one in East China, where people will have the opportunity to get free 15-minute rapid testing just before they go back to school. And this is a really good idea, people, if you've been traveling, or even if you've not been traveling and have just been doing a lot of stuff that week off. It's just going to it's going to allow us to go back to school with the ability, hopefully, not to have to scramble really quickly again and try and isolate students again. So I don't know if I really answered your question, but that is the process that we go through with our schools to decide if they should pause or not. It's really not completely based. Believe me, if it was based on community transmission alone, right, we'd just be paused, period. And we've learned that is probably not in the best interest of our kids. We have a lot more data that shows that if done properly, schools can be a relatively safe place for kids to go if it's done properly. And so that's what we're really focusing on and looking for, is trying to get our kids back in a way that the risk is low enough where we don't see a lot of cases popping out of that attendance.
All right, thank you, Doc. All right, this will be our final question, but if folks didn't have their questions answered, please email us at covid19@stclaircounty.org. And you can also watch this back from the beginning after we're done here on Facebook or YouTube, because we have covered a lot today and your question might have already been answered. All right, so this final question, are pregnant women able to be vaccinated yet? And will it require documentation from their OB to receive it? Is there a specific trimester to administer it in?
So none of these vaccines have been specifically studied in pregnant women, although all the clinical studies had women who became pregnant after the vaccine, so they all have some data. But there hasn't been a study specifically dedicated to pregnant women yet, and there are some now ongoing. So that's the good news. The other good news is the clinical trials did not indicate a problem, and there was no theoretical problem with a non-live vaccine in pregnancy. And none of these vaccines are live vaccines. So vaccines as a group have never been found to be a problem in pregnancy or in breastfeeding. The live vaccines are withheld, again, for theoretical risk because the live vaccines do replicate first to develop your immune response, and that was considered maybe a higher risk for a pregnancy. So that's more information to come. The other thing, though, I heard just recently is that, there is this vSafe. The CDC has a fifth surveillance process in place to monitor post-COVID issues. And through that, there is monitoring of anybody who's received the vaccine that's become pregnant. 60, 70 some thousand vaccines. There's a lot of people who've become pregnant after their vaccine. And what I've heard is there are no concerning signals with that either. In other words, no red flags that there are increased problems with this vaccine in pregnancy. What we do know is that if you're pregnant and get COVID, the disease COVID, your risk of having a more severe disease course is quite real. So talk to your OB about this. It is really one of those things we encourage you to have a conversation with. And again, if you're a low-risk individual, you might want to wait till there's more data. But if you're working in a situation where your exposure is pretty high, then the thought is that the benefit of the vaccine probably outweighs the risk, because the risk is quite honestly not even theoretical, and there's no signals to suggest there is one. One more thing while I'm talking about this. There is nothing to suggest this vaccine causes fertility issues in the future. We hear a lot about that. Young women of reproductive age afraid to get the vaccine, or even men of reproductive age afraid to get the vaccine because it's going to cause some future fertility problem. It's bunk. It's bunk. There's nothing to even suggest it. Even in a theoretical fashion, it was started as a rumor, and it is just perpetuated. So please, that is not a concern that any of us have in regards to this vaccine. So I just wanted to get that out there because I do hear a lot, and I understand how you'd be concerned about it if you feel that's an issue, but it's not an issue.
All right, thank you, Doc. Justin, any closing remarks?
Yeah, so again, if you or any of your family members, friends, anybody you know is not feeling well and is having trouble breathing or eating or doing any of the required functions of the human body, take them directly to the ER or take yourself to the ER. That is number one. Like Doc said, they cannot turn you away, so please get help. Two, for those of you that are below 60 or 64 and below, all 50 to 64, know that you haven't been forgotten. We just started meeting that age group. And like I said, it's going to take us about 2.5 weeks to get through that group. And then we're, as you know as well, we're open to the 16 and above with health issues as well. So we're working through both of those groups at the same time. But we do believe it's going to take us about 2.5 weeks. So you haven't been missed. You will get calls. They should be coming very quickly. So have faith. We are in a little bit of a dangerous period right now. So please follow those mitigation steps that we've asked you to follow during the previous 2 peaks, and just be very careful. Enjoy your weekend. Be safe. Take care of those around you. If you can help in your community in any way, please do. And I won't see you next week. I will be out of town, but please have a great week, and I'll see you the week after. Have a good night.
So I just want to say thank you. It's a privilege. It's a privilege to be able to walk with you through this unprecedented time. And I learn a lot from these sessions, and it helps us a lot to understand what people's concerns are. And we just hope that we're helpful to you. So thank you for that, and thank you for the opportunity. I also want to just say that Justin is a wonderful partner in crime. He's been a godsend to us, and today is his birthday, so I want everybody to wish him a very happy birthday. I know, well, you never said no. So I hope he has a great week, and we'll see you next week, Thursday. I will be here next Thursday, and God bless.
Thank you.
You're welcome.